And I said, come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. We are live here in the Town Tech Educational Podcast Studio at Portland High School. I'm your host, Dave Kuzminski, and with us this morning in the studio for his second actual full podcast is our first selectman, Mr. Ryan Curley, and also on the phone calling in as we have our Chatham Health Director, Mr. Russ Melmed. So we got a lot to cover today. So Ryan, what's happening?
All right, a lot of good things in Portland. I'll leave the Omicron and the COVID topics to Russ to cover.
Okay.
So we'll talk about what we've got going on in Portland right now. Well, first off, I want to thank our Portland Fire Department for a wonderful parade that they put on this Sunday evening.
Yeah.
That was pretty cool. There was Santa went throughout Portland.
Yes.
I hope he stayed warm. It was very cold out during this, but the fire trucks were all lit up, and we're just very appreciative for all that the fire department does and the festive nature that they put on this year. So and last year as well. But
yeah, I was talking to our deputy chief, and he said they actually traveled 36 miles, around town. So who would have thunk?
Yeah, I think it takes them 3 hours to
Yes,
to
they
get
were
around.
around, but from the response that we got from the residents, everybody loved it. It was fantastic. So everybody did a good job as far as in relation to the fire trucks were all decked out in lights, and we also had a fairly large component from our highway department as well. So that was nice. So great.
Yeah, and so that was great. So a lot of people want to know about Brainerd Place. That's been a topic that's been ongoing. I spoke with the developer last week, and the demolition's still in progress right now. And I'm hopeful that as you drive by on Route 66, you'll be able to see more of that progress that has been made.
Yep.
I've been told that the Starbucks, which is on a lot of people's minds, people want to know when the Starbucks is coming.
Yep.
And we're talking about the fall of 2022 right now.
Nice.
So I'm hopeful that is still in play.
Yeah, that I can get my lattes.
So let's see. Just so everyone's aware, we're almost in time for budget season, which is quickly approaching, and that's something that it'll be my first budget season as first selectman.
Yep.
And I met with the Long Range Capital Commission yesterday evening. So trying to get a head start on planning for those long-term expenses that we have coming on in town. And,
right.
And with that, I don't need to tell you, Dave, is our water and sewer and what we have going on with that.
Yeah, we got to get going with that, and hopefully we can keep that ball going forward here.
Yeah, so it looks like we are. I just was speaking with our Public Works Director, Bob Shea, about this, and looks like we're going to, we have these RFQs for a engineer or a consultant, really, for this, and we're going to bring the Water and Sewer Commission involved. I know there's a Water and Sewer Commission meeting on January 3rd, so we're going to start the year off very busy, and hopefully we can get a consultant chosen soon, and we can just dive headfirst into this.
Yeah,
so,
that'd be great.
Yeah, so yeah, that's pretty much all I've gotten. I just want to wish everybody who's listening a very Merry Christmas and a Happy New Year.
Yeah,
and
absolutely, it's that time, and we had a great tree lighting ceremony that you were at, as far as that goes, and I think we had a great attendance down there. Flicked the switch and got our holiday tree lit in front of the Brownstone School, and I think everybody had a great time, and the weather was actually pretty nice.
It's great. Yeah, and you did a wonderful job emceeing that as well, Dave.
Yeah, it was, it's been only a few years I've been doing that, so I don't know, it's like 30 or whatever. I don't know, but no, it was a great time. It was a team effort, and Nate and Andy and Youth Services coordinating everything and putting it together, and I think everybody really enjoyed it. And we kicked off the holiday season in grand style for sure. So anyway, all right. I think with that being said, I think Mr. Russ Melmed. Our Chatham Health Director is on the line. So, Russ, I know you've been keeping busy here, trying to keep up with where things are. So, give us the rundown.
Yeah. So let's talk COVID-19. It's a little bit of a mixed bag right now, and in terms of case numbers, there's more COVID-19 out there that we're identifying than there was this time last year. In fact, we're at about where we were after Christmas, and we've got a couple days to go before the holiday. So people haven't even had their Christmas gatherings, and we have more cases. The reason I say it's a mixed bag is because we have fewer people getting very sick. Even though we have more cases, we've got about 30-40% fewer hospitalizations statewide than we did at the same time last year. And what's even better news is people really are very rarely dying from COVID-19 because of vaccinations at this point. Last year, at this time, we were seeing around 50 to 55 fatalities from COVID-19 every day. And in the last week, we've seen about 56 fatalities overall for the entire week. So that's vaccines in a nutshell. They really prevent you from dying if you get COVID-19 and end up getting very sick. So that's good news. Where are we going from here? It really depends on people's individual behaviors. I don't want to say that it's inevitable that we're going to surpass last year's case rates and have overwhelmed hospitals, because we may not. But with the Omicron variant being much more transmissible, and that's the one thing we're sure of, is that it's much more transmissible. In fact, it's overtaken the Delta variant in just 3 weeks since its arrival here.
Right.
To the contrast, it took Delta about 2.5 months to totally dominate the strains in the United States and in Connecticut once it first made its appearance.
Right.
So Omicron has pushed out Delta in a matter of 3 weeks. So much more transmissible. Early reports are that it may be less likely to cause severe disease, but that's data out of South Africa. South Africa's a much younger population than we have, so take that for what it is, which is it's hard to make that direct comparison. Some reports out of the UK suggest it may not be less virulent, so we're still waiting to see how it behaves in the United States. It's only been around 3 weeks, so we could just be seeing a lag in hospitalizations and fatalities, and they'll catch up, and we'll all say, oh my God, this is much worse than Delta, or they may not. So we'll see, but it's more transmissible. So what does that mean for people getting together over the holidays? If you're fully vaccinated, I'm certainly not recommending that anybody forego getting together for the holidays. But there's some things that you can consider doing to keep everybody safe. So if you're getting together with people who are high risk, and I'll describe high risk in a couple of different terms. One, even if people are fully vaccinated, if they are older adults, especially over 75 years old, or have some immune suppressive condition, whether they're taking immune suppressive drugs because they've got like a chronic inflammatory disease like Crohn's disease, or they've had a transplant, or they're having cancer treatment. So if they're fully vaccinated but they fall into one of those categories, very simple thing that you can try to do is get a test in the day or two before you get together, just to see if you have COVID-19. And if you do, don't go over to that person's house. And everybody wants to get together for the holidays, but if you have COVID-19 and you know you're going to be around somebody who is at extremely high risk, it's really not a good idea to do that. The reason I say that get a test if you can is because testing capacity is completely overwhelmed this week in the state of Connecticut. We support a couple of state-funded testing sites in the district. One is in East Haddam, one is in Colchester, one is at Ram High School in Hebron. The East Haddam testing site we ran yesterday typically runs for 3 hours from 12 to 3. They ran out of tests at 1:30 and had to send a lot of people home.
Right.
And that's a report that I've seen all around the state, is that testing capacity is just overwhelmed, not enough tests.
Is that the PCR test, Russ?
That's a PCR test.
Okay.
Yes. So it's really, PCR is great, super sensitive. If you're negative, that's great, but you're not going to get your result for 2 or 3 days at this point. So how good is it to get a PCR result from 3 days ago when you're getting together with family tomorrow?
Right.
So the antigen tests really are a great tool. So rapid result testing, and those come in 2 different forms. One, you can go to a testing center and get a test. 2, thankfully now we've got these at-home tests. But you're lucky right now if you find them in a pharmacy.
Really?
You can go to a pharmacy, CVS, Walgreens, and you have to actually go to the pharmacy window where you would pick up your medications and see if they have at-home tests. They don't leave them sitting out on the shelf for people to shop. You have to request them. Many pharmacies, as soon as they get these things, they fly off the shelves. So,
wow.
Really difficult. But my recommendation is if you can also buy them online. So that's the other option. You can buy some on Amazon. You can buy them in various online retailers. Get an at-home test, and do it the day before and or the day of your get-together.
Uh-huh.
Some of those at-home tests, they'll come in kits of 2, and the recommendation is to do 2 tests 24 hours apart.
Okay.
And if they're negative that day you're getting together, in all likelihood, if you are infected, you're really unlikely to spread it to anybody at that time. So they're a really good snapshot in time.
Uh-huh.
If you can get tested before you're gathering, it's just a great tool that if you can get a test, to choose to do that. I am doing that, before my family gets together for Christmas. We are taking at-home tests. I hope that they are negative. If any are positive, because we're getting together with some older family members, we'll likely choose to stay home.
Right.
Not that we want to, but that's an option for people to do.
Sure. Now, those at-home tests are the antigen tests, correct?
They are antigen tests, yes.
Okay.
So they're similar actually to pregnancy tests,
Uh-huh.
and they are subject to some misinterpretation. So if anybody's got an at-home test, don't just look at the cover and think you can do the test. Read the package insert as close to in its entirety as possible. They're fairly crude. Nowadays you can get a pregnancy test, right? And you do the pregnancy test, and a little thing will light up that says pregnant or not pregnant, right?
Yeah.
Most of these antigen tests will just have a blue line and a pink line, and if both lines come up, then that means you're positive. Sometimes you might see some faint pink shading, and that can be confusing to people. So make sure you read the package insert carefully to understand as best you can what you're looking at.
Mm-hmm.
And use that. I mean, we didn't have this a year ago. We didn't have at-home tests a year ago.
Right.
We do have them now. If you don't want to wait in a 2 or 3 hour line to get tested, but you can get your hands on some at-home tests, it's a great opportunity. But testing capacity, Dave, Ryan, you're going to hear from residents probably that they can't find a test anywhere. And that actually is a big problem right now. The state, unfortunately, was slow to realize the impact that the Omicron variant would drive case numbers up to the point where they are.
Yep.
And so only now they're starting to talk about how we can expand testing. Not going to be in time for the holidays, unfortunately.
Right.
So it is unfortunate. I think what we're seeing this year that we didn't see last year, I just remember last year a lot of conversations among my own friends, colleagues, and family that went something like this. What are you doing for the holidays? Oh, besides going to work, I'm not doing anything in the 2 weeks before I get together with family for Christmas because I want to see fill in the blank, mom, grandma, grandpa, whoever. So people, in essence, behave very differently in the week or 2 before Christmas in the hopes that they would avoid getting exposed to COVID-19 and that they could gather safely together. I don't hear that happening right now.
Right.
I just said I took my family to go see a movie on the second day after its opening. So people are really not moderating their behavior much so that they can get together safely over the holidays. So we're seeing that in numbers. A lot of people getting COVID-19 right now. But, again, thankfully, we're not seeing as much severe disease as we did last year because vaccines work really well.
Mm-hmm.
So that's the mixed bag. When I say it's a mixed bag, that's it.
Sure. Do you think people are becoming more complacent, Russ, rather than cautious, or what do you think? Or you think that's the narrative that is being trumpeted nationally? Or
there are 2 things happening. One is that people who are fully vaccinated rightfully feel much more comfortable with what's going on.
mm-hmm.
I certainly do. I don't want to get COVID-19, but I feel pretty good about what's going to happen to me if I'm exposed, and the likelihood that I'm going to have a mild course of illness, to recover in a few days, and then go my merry way.
Mm-hmm.
So for people who are fully vaccinated, they rightfully feel they've earned the luxury of feeling complacent, Dave.
Mm-hmm.
Complacency doesn't necessarily mean bad or that they shouldn't feel that way. I think it's reasonable to say I'm fully vaccinated. I feel perfectly comfortable with my risk.
Mm-hmm.
The other thing I'll say, not complacency, I think there's just fatigue.
Right.
Think back to June. June, we were looking at incredibly low case numbers, vaccine rollout that had really accelerated to the point where everybody could get the vaccines just about, except for young children.
Mm-hmm.
And we sort of thought, before Delta emerged in India and came and swept the nation, we really thought we were in a spot where if you were fully vaccinated, you didn't have to wear a mask. You couldn't even get infected. That's where we were in June.
Mm-hmm.
I know it seems like a long time ago, but remember, there were a couple months where the CDC said if you're fully vaccinated, you don't have to wear a mask even, because you're at so low risk of even becoming infected that it's not a thing you need to do.
Right.
And that didn't last very long. And now, of course, anybody who's in a state like Connecticut where there's so much COVID-19 is recommended to wear a mask even if they are vaccinated.
Right.
So there's some exhaustion now. Where it seems like we've seen this movie before. Here we are heading into a really difficult time over the winter. But for the most part, people who are fully vaccinated remain very well protected, even from Omicron. Boosters do a good job of giving you more protection, so that's a good idea. If you haven't been boosted yet, you're eligible, you should consider it. But there's fatigue. I feel it sometimes.
Sure. Now, what's the protocol on? I mean, the schools have a different protocol now with as far as if you've been exposed, you don't have to go home, or you can quarantine or whatever.
Right. They call this screen and stay.
Oh,
and
okay.
It was working very well for a while, and now with so many cases, it's actually an administrative challenge for schools. So screen and stay acknowledges the reality that is, between two students sitting in a classroom who are both masked, that exposure rarely results in transmission. So if that's what happens, you're sitting in a classroom and both people are masked and they're exposed, one is exposed to another, they only have to screen themselves for symptoms and they can continue to be in school, which is great. I mean, I think it acknowledges the fact that schools are a really safe environment. But the burden it's placing on schools in particular to do the following things, they have to verify that masks were worn the entire time during that exposure. So if there was a snack time in class, then that's not eligible for screen and stay. If they ate lunch in class, not eligible for screen and stay. If there's a student that they know is poor with mask compliance, then that situation is not eligible for screen and stay. So there's a lot more in-depth information that schools are now having to gather for each of those exposures. For screen and stay to be an option, that with so many cases, the burden of doing all that work, as opposed to just doing regular contact tracing and saying all these people are quarantined, is difficult. It's difficult for them to manage.
Translating that to home, what would be the protocol? As far as either quarantining or what's your recommendation?
Yeah. So the social exposures, like things that happen in the home, the workplace, things that outside in your regular day-to-day activities. If you're exposed to somebody, you spend 15 minutes within 6 feet of somebody who's sick, especially if it's in your home. If you're fully vaccinated, there's no recommendations for you to quarantine at all. So you should get tested, anytime between 5 and 7 days after that exposure occurred, and wear a mask until you get that negative test at least, at all times. For people who are unvaccinated, it's the same old. If you're exposed, you should get tested, again, 5 to 7 days afterwards. If you get tested on day 5 or afterwards, it's negative, you can shorten quarantine to be 7 days. And that works for many people. But with testing resources under such strain, it's not so easy to say, go get a test. If it's negative on day 5, then you can quarantine for 7 days and be okay. But that is the recommendation, is to quarantine for at least 7 days, and if you get a negative test, then you can go back to your daily routine on day 8. But getting a test is difficult right now. So otherwise, if you can't get a test, quarantine for 10 days.
Sure.
I will suggest, though, that it seems like with the Omicron variant that people are getting sick in a shorter period of time after exposure.
Mm-hmm.
So it may be to our advantage to have the Omicron variant, so long as it doesn't cause more severe disease, simply because most people, you don't see it take a week or more before they get sick.
Mm-hmm.
Most people are getting sick in the first few days after exposure. So might that change the recommendations for quarantine and isolation? It might.
Right.
It might.
Now,
Not in time to, impact the holidays, but I think we're seeing some changes in the virus that are both concerning but also open up a window of opportunity for us to make changes to the recommendations for prevention.
Right. Now, is what's your recommendation for folks, flying to go, or
Yeah, flying. Well, everybody wears masks on airplanes, and air travel has seemed to be a pretty safe endeavor once it resumed, with everybody wearing masks. If you can get your hands on some higher level of protection for masks, so move away from a cloth mask, get a surgical mask. Move away from a surgical mask, perhaps, and get a KN95 or an N95 mask. Those things offer a higher level of protection. So can I suffer through wearing an N95 mask for a few hours on an airplane in an airport? Sure can.
Mm-hmm.
Do I want to do it on an international flight that's 23 hours long? I sure don't, Dave.
Yeah, I hear you.
Those N95 masks, they are like suction cups on your face.
Yep.
They pull really tight.
Yep.
They will leave a mark on the bridge of your nose because the wires are really tough.
They fit well.
So, but if you can get a higher level of protection from your cloth face mask if you're going to travel, that would be great. And by and large, those things are available right now. There's no sort of supply chain issues with personal protective equipment like masks. So, wear a mask on the airplane, wear a higher level protection mask, like at least a surgical mask, a KN95 or N95 mask, and you should be fine.
Right.
We haven't really seen much transmission on air travel, so that's good news.
Now, does double masking help as far as?
Yeah, so multiple layers are better. The more layers of either fabric or paper, if you're wearing a paper surgical mask or whatever, the better. It's whatever you can tolerate.
Okay.
If you have to wear a cloth mask, wear one that really fits as snugly as possible. That's made of 3 layers of fabric is best. Hold it up to a light source. If you can see light easily penetrating the mask, it's probably not good enough. So those are the recommendations for masks. Yeah, double masking is fine. If you still have to go with the cloth mask, it's a good idea. But again, if you're fully vaccinated and you're exposed and you get sick, most people that we're seeing are getting very mildly ill.
Right.
So at this point, the recommendations for people who are fully vaccinated really circle around who they are going to be around.
Right.
If you get sick, you're probably not going to get very sick, but if you are going to be around somebody who is unvaccinated and or high risk, then think carefully about your behavior leading up to that exposure.
Right.
Masking, doing a little less socializing beforehand, getting a test, getting a booster. Those are the kinds of recommendations that we're making now for people who are fully vaccinated. Is try not to make the person who you're going to be around, who might be vulnerable,
Mm-hmm.
very sick, because you could.
Now, as far as what typically are your atypical symptoms of Omicron? I mean, is it?
It's all the same cold symptoms. Mostly is how it starts off. We're still seeing loss of taste and smell. Some of the atypical, the ones that we don't see often but that happen sometimes, are like nausea and vomiting and diarrhea.
Mm-hmm.
So the problem with that is there's a lot of things right now in the wintertime that circulate that cause nausea, vomiting, and diarrhea. Principally, it's norovirus.
Mm-hmm.
For anybody who's ever caught the typical stomach bug,
Yep.
You feel like death for about 12 to 24 hours, and then you kind of get better. Nausea, vomiting, diarrhea. If they come on suddenly, and it feels like you're going to die, that's probably norovirus and not coronavirus. But if you got some mild nausea, you feel like you're going to vomit, maybe you have some runny stools, that could be COVID-19. So that's my word of advice to anybody who's starting to feel sick of any kind is to try to get a test.
All right.
And
right.
assume, because it's COVID, because there's so much COVID out there, just assume that what you've got going on is COVID-19. Don't dismiss it. If you're going to be hanging out with somebody, like I said, very vulnerable, unvaccinated, older adult, immunocompromised, things like that, think carefully about whether or not you want to visit them in the hospital later.
Right.
There's a chance.
Now, most of the cases being hospitalized now, they say that the stats are basically they're 70% unvaccinated. pretty much?
It's actually about 76%. So think about this. Fewer than a third of the residents in the state of Connecticut are unvaccinated, but they make up 3/4 of the hospitalizations.
Ah.
So I'll say it again. Fewer than a third of the population of the state of Connecticut are unvaccinated, but they make up 3/4 of the hospitalizations.
Ah.
So, the ratio is somewhere between, if you're unvaccinated, you're somewhere between 8 to 10 times more likely to end up in the hospital compared to people who are vaccinated. And it's somewhere around 12 times as likely to die from COVID-19 if you're unvaccinated compared to vaccinated. So the vaccines do really work very well to prevent the worst outcomes, and they remain effective against the Omicron variant. Think back to the director for Operation Warp Speed back in, we're talking about in early 2020, was to get a vaccine that was 50% effective at preventing hospitalization and death.
Mm-hmm.
And, the Pfizer and the Moderna vaccines were somewhere in the area of 95% effective at that originally.
Yeah.
And now they've diminished. The Pfizer vaccine is somewhere in the area of 70% effective for the Omicron variant, so it's somewhat diminished, but
Still well over
it's
50.
still above the target for
Sure.
the whole Operation Warp Speed, which was designed to get us a vaccine that was 50% effective. So they're still great vaccines. The one thing that has changed recently is with the Johnson & Johnson vaccine.
Right.
Just 2 weeks ago, the CDC and the FDA came out with a recommendation that the preferred vaccine for the prevention of COVID-19 are either the Moderna or the Pfizer vaccines.
Right.
And if you have a choice, so long as you don't have a medical reason that makes the Moderna or Pfizer vaccines contraindicated for you, you should get those above instead of the Johnson & Johnson vaccine. That goes for boosters as well. If you got the J&J and you haven't been boosted yet, unless there's a medical reason not to get the Pfizer or the Moderna vaccines, you should get those as the booster. So that's a new recommendation. Actually surprised me quite a bit.
Right. Right.
When they made that recommendation.
Now there isn't an issue anymore in mixing and matching, is there?
No. Mix and match as much as you want. But I'll say again, mixing and matching, if you got the Pfizer and you want to get Moderna, that's fine. There's no evidence that kind of mixing and matching is better or worse. If you got the Johnson & Johnson vaccine, you really should strongly consider getting either the Pfizer or the Moderna. At this point, it's pretty clear that they're better at preventing severe disease, especially with the Omicron variant, and they come with a much lower risk profile. What they found with Johnson & Johnson is that they can cause this rare but potentially very serious clotting disorder called TTS. I think it's thrombosis with thrombocytopenia syndrome, and it's a clotting disorder that can cause some bad outcomes. So I think we're talking only about a few dozen or maybe a couple hundred cases, but around, I think, several people have died from this condition. I don't have the numbers in front of me.
Wow.
So that's just with the Johnson & Johnson vaccine.
Right.
The mRNA vaccines, Pfizer, Moderna, those were the complications that most people are aware of are myocarditis, mostly among adolescent men. Those cases of myocarditis are extremely rare, and they're very mild, treated with over-the-counter anti-inflammatories in a lot of cases.
Right.
And so really the Moderna and the Pfizer vaccine, lower risk profile, better protection. So I think that's what led the FDA and CDC to make the change in recommendations, which was interesting.
Right. All right, Russ. Now reach into your desk drawer there, will you, and pull out your crystal ball.
Yep.
Okay.
I got it.
And I know a lot of schools now, as far as the colleges, are shutting down early. A lot of them are making contingency plans for going remote. What are your thoughts? In fact, they're even considering canceling Times Square for New Year's. So what do you think?
Yeah. So I think I tend not to agree with the idea to close schools. Mostly because we see that young people tend to be they're way less likely to have severe complications of COVID-19 compared to adults. And, they're not driving hospitalizations like other people are, and specifically people who are, older and or unvaccinated. And many colleges have required vaccination as a precondition to coming back to school.
Right.
So I don't really understand the idea of closing schools. They may be administrative reasons for doing that have nothing to do with preventing COVID-19. I suspect that that's what's going on. I remember even last year with our own K through 12 schools, And many went to distance learning simply because they were overwhelmed by cases and contact tracing, not because they were overwhelmed with people who were very sick.
Yeah.
So I see it as being more an administrative convenience, because they still have to follow the ideas of contact tracing and quarantine and isolation. So when you start doing that and you have so many cases, you end up with a lot of people who, A, aren't coming to class, B, can't teach if you've got teachers, that COVID-19.
Right. That was an issue with staffing, too. I know.
Right.
That.
That's what I mean by administrative. It's really it's a staffing shortage, and it's an ability to continue implementing the public health recommendations, principally contact tracing, quarantine, and isolation, that make it just a huge challenge when there's so much COVID-19 out there.
Right.
But strictly as a preventive measure, most people are exposed at home,
Right.
in social settings,
Mm-hmm.
not in schools. So the idea of closing school to prevent COVID-19, I just don't see it
Right.
as being that helpful. But as a matter of administrative convenience, I certainly do, which is tough. Our schools are in the thick of it right now. I hear from our school nurses in K through 12 schools, and how difficult a time their nurses are having right now. In particular.
Sure. Well,
It's just
too,
really hard.
as far as for public and in stores and so forth, a lot of stores are requiring masks again, to go inside and
Yeah, especially when you're going to be in a crowded indoor setting. Crowded indoor settings in particular, where you can't, where the aisles are narrow and you're, retail shopping, or you're in a restaurant and it's crowded and there's standing room only. Those kinds of settings are ripe for transmission of COVID-19.
Mm-hmm.
So places like that, it's right to ask patrons to wear masks.
Mm-hmm.
In less crowded indoor settings, your typical office setting.
Right.
If you're sitting by yourself at your office, there's really no reason to wear a mask.
Right.
If you can keep your distance from people, really no reason to wear a mask. If you're sitting at a meeting in a room with 12 others, you're sitting around a board meeting, a
Conference table. Yeah.
conference table, wearing masks is just a good idea.
Yeah.
If you're in doing Christmas shopping last minute and the store is packed, people should really be wearing masks.
Yeah. Exactly.
But otherwise, if you can distance from other people, it's a pretty safe environment, and especially if you're vaccinated. But those indoor spaces, when they're crowded, that's where we're seeing a lot of transmission still. So
Sure. Well, I know the mayor of Boston has implemented a mask mandate, as far as in all indoor settings, restaurants and that type of theaters.
yeah, well, the places in the Northeast, we all spend time indoors right now.
Yep.
I mean, I woke up yesterday morning; it was like 16 degrees. So
Yes.
we're all spending a lot more time indoors, and in crowded cities like Boston and New York,
Mm-hmm.
where just about every indoor setting is crowded.
Yep.
You walk into a coffee shop in New York City to get a bagel and a latte, you're standing shoulder to shoulder with people for
Yep.
20 minutes.
Yep.
There's just no way of getting around that in places like that. In places like this, you may be able to go to, I don't know, Echo Coffee in East Hampton or Dunkin' Donuts, and you might not be crowded shoulder to shoulder.
Right.
But still, masks are really effective. They're really not that annoying to wear in those settings for brief periods of time.
Sure.
I don't understand the resistance to just doing the right thing on your own.
Yeah. And I think people are used to them. I mean, I know kids are. I mean, that's kind of a muscle memory now. I mean, you talk to kids and they're always wearing a mask now.
Yeah. If anybody needs to understand how effective masks are, just look at our schools.
Yeah.
Kids have been wearing masks in schools, and we've rarely seen transmission of COVID-19 in schools. So I just don't see why adults can't look at those settings and say, hey, masks work. My kid is really not having a hard time with this.
Right.
What's the big deal if I wear a mask when I'm waiting in line for my coffee?
Yeah, exactly.
I just don't see a problem with it. So, for those businesses that are implementing masks as a requirement for entry, my advice to any resident out there who disagrees with this approach is to be tolerant of those businesses. They are really, in a lot of cases, having a hard time staffing.
Sure.
Maintaining staffing. It may not be to help you out. It may simply be because they are trying to keep their staff safe.
Yes.
And stay open for you, the patron.
Yep.
So be accommodating. Be understanding. If you're walking into a place where masks are required, to just do your part. It's not a big ask to stand and wait for your coffee with a mask on.
Sure. I know. At my music school, we're requiring masks again, and we still have the I still have the plexiglass shields between
Sure.
students and teachers and so forth, and wind instruments are always basically using the bell coverings and all that kind of good stuff.
Yeah,
So
my son plays trombone. They did he plays in a jazz band, and he did the bell covers, and they did all the things that they're supposed to do. But then, of course, afterwards, I asked him, I saw you tap your trombone on the floor. What was it? He said, I was emptying the
a spit valve.
I said, you just dumped that out on the floor? He said, yeah, everybody does it. I said, oh my God, there goes the idea of bell covers when you're just dumping your spit valve on the floor and everybody's doing it and walking through
well,
it.
most of them are, as far as they put like pee pads on the floor, so you can,
Oh, do they?
Yeah,
I didn't see anything like that at my son's jazz band concert. So maybe
okay.
it's a recommendation to the
Yeah.
to the concert director that they put some chucks or some absorbent pad down there on the floor.
Yeah, spittombs or something. I don't know,
Yeah,
whatever.
I thought it was pretty disgusting. Not just as an epidemiologist and public health professional, but as just as a parent. I thought this was kind of disgusting.
Oh my God, unbelievable! So,
Yeah.
all right, Russ. Well, thank you so much for the update. And
Sure. Well, let me one more thing. Let me just talk
Sure.
about vaccinations for a moment,
Yep.
because Portland right now is doing a really good job with vaccinations. Portland is the only town in Chatham Health District that has reached 80% of the population having received at least one dose of vaccine, and 74% have been fully vaccinated. That's a really good number. If we want to talk about ages, Portland is once again, leading the charge in Chatham Health District anyway. Around almost 43% of 5 to 11-year-olds have initiated vaccination. That's a great number to start with. I'll just throw out a contrast there. In East Haddam, which has the lowest vaccination rates in Chatham Health District, only 12% of 5 to 11-year-olds have initiated vaccination.
Really, wow.
Compared to 42% in Portland. So, for parents out there who are doing that with their kids, that's great. I think it's the right thing to do. Your schools are certainly thanking you. Your school nurses are probably thanking you
Sure.
because it makes contact tracing easier for them.
Mm-hmm.
So vaccinations are out there. They're abundant. Get vaccinated, get boosted, get tested before you gather for the holidays. If you're sick, stay home. If you have to be out in crowded indoor setting, wear a mask.
Mm-hmm.
That's it in a nutshell.
Now, do you have any upcoming vaccination clinics that we can promote, or testing clinics that are know they're going to happen?
Yeah, so we run testing clinics on Mondays, Fridays, and Saturdays. So we just ran one yesterday. The Friday and Saturday, obviously, we're not doing those. One is Christmas Eve, the other is Christmas Day. So we're not doing those. And in terms of vaccine clinics, the next vaccine clinic we have is next week, I think on the 28th, so 1 week from today. We're going to be in East Haddam doing both a all-ages vaccine clinic. Mm-hmm. All ages, all types, booster, 3 different vaccines, five ages 5 and up. That's going to be around midday at the East Haddam Municipal Office Complex.
Okay.
And then starting in January, the demand for boosters seems to have increased. So starting in January, we're going to be doing weekly booster clinics, I believe, at the Colchester Federated Church. So we're going to establish some regular hours, walk-in appointments, just so everybody knows it'll be at a certain point, a certain place, a certain time, at least one day a week, maybe more, and people can just kind of show up when they want. So I think having those regular hours is the easiest thing for people to do instead of different places at different times, different hours.
Right.
I think establishing some regular times and hours is a good thing. So, but that's not really going to be until the first of the year. Right now, staff, they're on vacations. Our nurses on vacation, well-deserved.
Yes.
So some of these things are slowing down just for the next 2 weeks.
Sure. Well, like I say, if you want to do something, hook up with Ryan, and he'll hook you up with a location here. Yeah, definitely.
Oh, yeah. Well, we are looking to expand testing in the new year. So, right now testing is just under such strain. For people who are looking for a test or a vaccine, you can call 211. They are a good clearinghouse for information for upcoming vaccine clinics and testing clinics everywhere in the state. If you're looking for a testing clinic, you can also go to the Semaphore website. That's the testing contractor we've been using. They run testing clinics all over the place as well, Semaphore. And Griffin Health, we partner with them through vaccine clinics.
Right.
If you're looking for a vaccine clinic, they've got a good list of vaccine clinics there on their website. So a lot of places you can find the information you're looking for, but 211 is probably the best resource.
Yeah, I think urgent cares, too, are doing testing also.
They are, yes. Most are appointment only, and right now many appointments are a week out at this point, because so many people are looking for testing. But yes, urgent cares, CVS, Walgreens, they are all doing testing. They are appointment only. So, go and look for the tests. To get an appointment, go on the CVS website. You can. There's one in East Hampton. I think there's one there's a Walgreens in Portland that might be doing testing. So you can go onto their website and schedule an appointment for a test, but you might have to wait a few days.
Great. Yeah, before we let you go, Russ, so what's, if you've been boosted, what's the typical protocol to be, or time frequencies to be boosted?
Yeah, if you're 6 months past your second dose of Moderna or Pfizer, and you're 18 or over, actually I believe 16 and up for Pfizer, you can get a booster. You're eligible. So that's the time. You just have to be 6 months past. If you're 2 months past your Johnson & Johnson vaccine, you're eligible for a booster.
Okay.
So at this point, most people who were vaccinated in the first, say, 4 months of the vaccine campaign last year, from December through April or May, they're eligible.
Now, if you've been boosted, is there 6 months after you've been boosted, or 8 months, should you get boosted again, or?
No, at this point, there's no recommendation. Boosters really have not been around for long enough to be studied to understand how long it takes for the immunity to wane.
Okay.
But I think it's pretty likely that this is going to be something like an annual shot until everybody's been exposed, until we stop seeing variants that might sidestep immunity. But if you've been boosted, there's no recommendation for an additional booster at this point.
Okay, great. Fantastic. All right. Ryan, you got any questions here?
No, I just want to say thank you, Russ, for all your work on ongoing work regarding COVID-19 for Portland residents.
Sure. Well, it's what we do, and we'll keep fighting the fight.
Excellent. All right, Russ. Mr. Russ Melmed, our Chatham Health Director. We are live here in the Town Tech Educational Podcast Studio with our first selectman, Mr. Ryan Curley. This is your second podcast, Ryan. Awesome job, man.
Thanks, Dave. Thanks for having me. I hope to continue this and be back.
Oh yeah, we're this is you're in the loop now. We'll keep those updates coming, and like I say, Russ has been a frequent flyer on over 90% of these guys. So Russ, thanks for your participation and all your wealth of knowledge that giving our residents and all our residents in the Middlesex area an update. So thanks so much.
My pleasure, Dave.
All right. Hey, everybody, that concludes our episode number 45 here for the Town of Portland podcast. And again, on behalf of all of us in the Town of Portland and the Chatham Health District, we want to wish everybody a happy and safe holiday. Enjoy yourself and stay safe. Wear your mask. So we'll see you soon. Thank you so much. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the Town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.